basically, when somebody goes to sleep at night, a lot of people sleep on their back. And what happens is their tongue closes off their airway, and they're very relaxed. And a lot of times people don't even know that they stop breathing at night. Well, what happens is the tongue is closing off that airway, and people are basically gasping for air. And it is very dangerous. People might not realize that they have it. We treat that in our office by making a sleep appliance, whether it's as simple as a snore guard or a more specific one that will really open up your airway when you bite into it, so that your tongue can't close off the airway. It will allow you to have more oxygen at night. And a lot of people who feel like they are just real tired later in the afternoon, can't explain why they're so tired all the time. A lot of it can be attributed to sleep apnea, and something is blocking your airway while you are sleeping. And most of the time, it is your tongue. And the appliances that we make are very comfortable to wear, and they're very effective at opening up that airway. So when you sleep at night, your tongue doesn't close off your airway. You get more oxygen. You feel refreshed. People are sleeping better, and they just feel fantastic wearing it. The number one cause for people who have sleep apnea are people that are overweight. They have a large neck size, usually greater than 16. So most of the time it's men that are a little bit heavier. And of course, the number one thing to do is say, well, let's try to lose some weight. But there are plenty of women that are very skinny, not a large neck size, that can have sleep apnea. It can just be the way that the oral cavity is, the size of your tongue, how big it is, whether it can close off that airway. Alcohol can help increase the effects of sleep apnea. In our office, we look at several things. We always ask at a screening, do you have trouble sleeping? Do you snore? Are you overweight? Do you have a neck size greater than 16? Even people that have high blood pressure, all of that can be contributed to sleep apnea. Just as you get older too, the muscles of your soft palate get more relaxed and more flimsy, and that's that vibration of oxygen traveling into that airway. So it does happen usually as you get older, and in general, men and overweight men, but not necessarily.